media outlets do tag the biggest slum in West Africa. But then we are here today and we had a different perspective and a different view. You know, it's okay to learn from experience yourself. So initially we had a community project that is centered around women empowerment. But today, what we see and experience here today, we felt like we need to sensitize teens on sexual education. So currently with me here today, I have my fellow team member in person of Aisha here, and I also have Ejiro, that's Kashi, and that's Mba Heritage, Mba Heritage, and behind the scenes I have Iyema and Promise. So apparently today we would just discuss few points and things we felt like the teens need to understand before undergoing sex. You know, of course, there's little to how we can tell them to abstain from sex, but I feel the best thing we can do to them is to train them on how to, you know, avoid early pregnancy. And that is where Aisha come in. I feel she's an expert in the industry. She has years of experience and she would be willing to share more insights as regards how best to curb early pregnancy. Aisha, over to you, please.
Hi. So my name is Aisha Fashiku. So our journey today in Makoko specifically, we came across some things and I was actually quite shocked by a particular pregnant teen I saw who had scars from cane and she was heavily pregnant. So I guess I showed one or two people and that was actually what even led to this particular conversation. So the thing about teenage pregnancy is, firstly, lack of parental care. We feel it's a problem in Africa, especially in this part of this world, Nigeria, where you start talking about sex education to children. While growing up, when our parents tell us, when you start your period, don't let him touch you, you get pregnant, don't let him do this, you get pregnant. But that particular notion is outdated already. So we need a more we need a more technological, because this is the technological era, and a more feasible explanation on how to avoid such in society. And it also helps with to curbing population growth. So the first things first is, I believe at the earliest, a 2-year-old child should know about our genitals. A 2-year-old child, because we say by 7, the brain is fully developed. So from 2, a child should be educated about our genitals. If someone touches me in this particular part, I should know it's a red signal that, okay, this person is not meant to touch me. So, apart from that, parents specifically have a lot of role to play in this aspect. First, after teaching your child, while training the female child, you should not neglect the male child also. They also play a key role in this. So what you need to do is inform your child, sit them down. Okay, this is your breast, this is your private part. Nobody's meant to see, nobody's meant to touch. So let's elevate it to growing up now. 13 years, but let me put it to 9, since some people get their periods at the age of 9. And from a personal experience, I know of someone that had sex earlier, even without getting the period, and it triggered, I don't know if I should call it a particular type of infection, because she started having vaginal discharge that wasn't even close to probably yeast, or I can't say, but it became a very recurrent issue with her. So, but that aside, at the age of 9, puberty begins for most or for few sets of children. So what you do is this: you give a proper hygiene training. Okay, this is how you clean your genitals. You need to do this, shave when you see this and that. You teach them. So another thing is, we are not saying you should not teach sex education. And you teaching sex education does not mean prompting someone to partake in the act. You are just informing. Information is key. Most people hold information, they know when to avoid. So it is not like a trigger to partaking in the act. Teaching to abstain is easier because most parents, you hardly see signs. I heard in our time our parents tell us that you see signs of someone that started having sex is a big lie. They will say after glow blah blah blah. It's not true. Fine, some people might say it, you see, well, there are so many people, they do the deed, they go back home like nothing happened. So how can you differentiate? So what you just do is sit your child down. Okay, so don't do this. Why don't we teach them to wait to the right age? Typically 16. Typically, let's forget moral preachings. Typically 16. A child needs to know from 16 years of age that okay, this is what I want when it comes to sex. We are not encouraging, but we just need to know that there are some hard conversations you need to have when a child clocks 16. Typically. So this is what I like, this is what I don't like. When someone touches you like this, quickly you let them know I don't like it. Because you see signs of harassment earlier. It's just that most of us are just blind to those kind of signs because it comes as normal physical touch and everything. But when you are as a 16 years old, you can tell the difference between someone that is sexually harassing you. You can tell the difference typically. So what you just do is, at the age of 16, that is when you need to have a full-blown sexual education conversation with your female child. Full-blown. There's no need to start hiding anything. And I think it also gives the opportunity for children to talk to their parents, especially mothers, because I believe the conversation is more comfortable among females. It gives them the opportunity to talk to their parents. You talk, okay, mommy, so thing happened to me. And from there, as at 16, you can start seeing signs of lumps in the breast also, safe, because it's very important from 16. And some lumps are not cancerous, some are just something you just need to use a particular drug to just flush it out. So there's this test they used to teach us in primary school. They tell you to lift your hand above, you use from your armpit here, you start checking, then you go around your breast to feel. So if you don't tell someone that you need to do it, the person won't know. But you need to tell. So for maybe every 2 months, you try that. So when you feel something strange, you know you are going to the hospital. So the breast is also part of your genital organ. So it also plays a key when it comes to the reproductive system, when it comes to giving birth and everything. So it's also a key role. So you teach your daughter, okay. So at the age of 16, when you start your period, we teach about cramps. Okay, what are the things we use for cramps? There are some foods you need to eat during that period to reduce the level of the cramps. Some people used to use brown sugar water to reduce cramps during period. Some will take lemon water. Like they are just different, and there are some drugs too. Some people use Felvin, but I believe Felvin is for people that have mild cramps issue. But there are also some stronger drugs that can help reduce those kind of pain. So healthy period is also important when it comes to reproductive health, because we have people that uses their pad for more than 5 hours. In fact, typically 3 hours is enough, or 2 hours, because depending on your flow also. So anything 8 hours, you start seeing the pad start to get moldy. So the bacteria goes back in. That's where you start having issues of yeast infection and some other severe infections that might later affect the urinary lining. So most people are not very conversant with this kind of conversations because they believe that it's not just pad. That's why we look at people that use all these tissue papers, clothes, cotton. Pad was designed for a particular purpose. Before a pad can start to mold, unlike cotton wool tissue papers, it takes a while. Once blood touches a tissue, the blood dries up a little bit, becomes brown. Before you know, it becomes green. Now imagine you having something green underneath you. Before you know, the bacteria starts to pass back inside. So that is actually a very important conversation when it comes to reproductive health. We need to teach our girls how to be hygienic when it comes to their period. The one pant, I only like black pants during my period. Nigga is dirtiness. You don't need to be wearing black pants because you're on your period. As a lady, you should be able to take care of yourself. Okay, even my phone is heavy, for example. if I go, I can't go out, I can't do this. If your flow is heavy and you want to use pad, you can use two. This is the way we used to learn it now. If you place the first one, the second one, place it on it at the back. So if you are sitting down, instead of it flowing to the side, it will flow to the back. There are things, see, these are conversations I believe parents should be telling their children. It's very, 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 very important. Okay, so let's leave the whole period, menstruation side of this. In schools, you can't determine maybe your child is already seeing someone, but I believe there is a particular age you get to do a pelvic exam. That is the earliest time you discover whether a person is going to have reproductive issues. So sometimes every periods are not even because of the period. It's probably due to an issue in the reproductive area. So we have some people that if they are on their period, they faint, and you'll be wondering what is wrong with them. Sometimes the blood flow is so heavy that the person loses consciousness, in and out of consciousness, in and out of consciousness. It's not normal. You go to hospital, you do true pelvic exam, you see this kind of things. Doing sex with boys, okay, you have sex, let's teach them. Oh yeah, you now want to do the act, use condom. I don't think a 16 years old, 17 years old, 18 years old has any business with pull-out method, any other method. Use condom. Condom break, the next thing you should do, go to hospital, post-pill. And if you are someone that, okay, you can't judge anybody, you don't know where a child grew up in, because we know people that have actually sexual tendencies when they were young, probably assault or the likes. Some of them have little to no control of their sexual urge. So you can't determine the reason why someone is doing this particular thing. So let's assume you find yourself in that kind of position, you go to hospital. There are some treatments they will give you first, because you have come to any type of infection. All these teenage pregnancies we are seeing, when during the process of giving birth, vaginal fistula happens. There are so many vaginal issues. Some people find it hard, gallbladder, to even hold urine during that period. So there are so many repercussions when it comes to this thing. Sex is not a sin. It's not a crime. It's an human nature. I believe everybody knows that it's an human nature. At the end of the day, people that are getting married probably do. So at the end of the day, it's still the same thing. So what I'll just tell you is the necessary healthy sex, safe sex is very important. Teach your child how to partake in safe sex and healthy sex. Thank you.
All right, Aisha, thank you very much. That was a beautiful conversation, and I believe our viewers out there are being able to get 1 or 2 points from you. But before you go, you made mention of post pills and things, and I have a certain a question around that. You know, the community you find yourself would also determine the level of confidence you have when it comes to sexual education. And children of this age, at this age, I don't feel they will be confident enough to, you know, walk into an hospital to talk to the nurses or the doctor about having sex together. How best do you think the community can help, and what best do you think can be done in this situation?
Okay, thank you very much. I think that's a very important question to ask. The thing is, in most developed societies, there is access to condoms.
Okay.
If there is free access to condoms among you teens that have the kind of age grade I said, I don't think we have use for post-pill. Probably post-pill might be a last resort when probably if the condom broke or something like that. And besides, post-pill is not healthy enough. Because if someone has access to post-pill today, have sex after 3 days, come back, this same post-pill, saw somebody else, come back, it won't even work any longer, and it will disrupt the reproductive cycle.
Okay.
So I won't advocate for making post-pill readily available, because it's a drug that you are taking, so you can't determine what will happen. But access to condoms There are female condoms. I used to carry one around at a particular point in time. So if I used to carry one around, I even used to teach people how to use it because there was an organization I advertised in my university days one time. So I like taught people how to like insert it and everything.
Okay.
There are female condoms available. But the thing now is, how do we drive awareness? And how do we drive maybe probably investment of funds to equipping schools, going around to schools and making condoms readily available? These are things that a teenage boy should always have, every time.
I believe the question would be solved by our audience. That's a puzzle our audience should help us do justice to.
They can also inform us about organizations that can help us, because we need to like make it a new norm. Because sexual issues, many things relating to sex now, start from secondary schools, sometimes primary schools, but mostly secondary schools. We can make this thing readily available to everybody. And make sure that another thing, we used to make sure that the condom is never expired.
Okay.
Because that also can also cause another kind of issue.
Yeah, you're right.
So readily available condoms can avoid all this issue with post-pill to, because naturally, I think post-pill, even averagely, post-pill should be around 700 to 1,000
per pill.
Just that one carton.
Okay.
So now, somebody that is in school, or probably is just out there in Yoruba will say, Olo yokodo.
Olo giokodo. Okay.
Olo yokodo. How can you be certain that she even has the money for that pill? Okay. How are you certain that the person that had sex with her also has the money to give her to get the pill? So the best thing I will always advise, make condom, both female and male condom, readily available. And even if it's available, it should be affordable.
Available and affordable, because affordability would determine how far they will be able to go in terms of their purchasing power. Because we understand teens of this age don't have access to enough funds. But then due to the fact that technology, they are exposed to a lot of information online, and most of them find joy in investing their time in the negative informations, and they tend to try to do what they see online. They want to practicalize it and make it a reality. But thank you so much, Aisha, for your time. I really want to ask one more question before I proceed to the next person. I feel it's very important, the same way we are encouraging them to go use protective sex and prevent unwanted pregnancy. I feel it's important. I feel it's important to also tell them the advantages and disadvantages of having sex early. And I feel like it's okay for us to go as far as educating or orientating the community to ensure that sex education is a thing that pass across to everything. Or what do you feel?
The best bet is still to preach abstinence.
Abstinence, yeah.
That's the best bet.
I love that.
But this sex education issue is because, should in case abstinence has been forgone, this is the next solution. A 16 years old has no business with sex.
Yeah.
So abstinence is the real deal. Sex education is just a preventive measure should in case we forgo abstinence.
Yeah. Thank you. Thank you very much, Aisha. That was a wonderful conversation with you. I so wish we have enough time to continue this conversation. I know there's a lot in there to share to the general public. But then, for the sake of today, thank you for coming. And I also have Madam Dupe. I have Madam Dupe here. She would be the one to talk on. So I have Madam Dupe here. She has a little word of admonition to add to the course here. So Madam Dupe, can we have you?
Yeah, so hi everyone. Concerning this issue on ground, I've seen so many experiences here because I live here in my area in Makoko here. I've seen so many young girls that are really dealing with giving to so many children, and I don't know, it's not planned. They don't plan for it though, but once it's come, they will just have to take it that way. And I don't know, we Udo Foundation, we are here. We are calling out to people that can really support us, because this issue is a very, very big one that nobody is talking about. And so we want to reach out to people that can really back us up on this issue. So that we can settle this issue on ground and everything will be.
Alright guys, thank you all for joining the conversation today. Apparently we'll do this some other time, but then the reason why we are putting this out there is to ensure everyone is informed about the happenings in this community. You know, if you're not here, you won't know what's going on here. Thank you for